the Jewish faith for looking for the tree of life. And so when it comes to longevity, we've been kind of looking at longevity for a long time. And when I actually ran the model on this, the simple answer came back of clean water. I was like, what on earth is going on about clean water? And I sort of dug more into the model. And why is it moving? What's going on? Here we go. And if we look at kind of the fountain of youth and what it meant back then, well, the life expectancy, if we looked in sort of the last couple of hundred years, would be 40, would be a good life. So if I said to you, some ancient Sumerian, that I could double your life from 30 to 60, or even 20, from 25 to 50, by drinking from this particular fountain or this spring that has particular minerals in. And I love these pictures in here because it points out sort of rivers and things where they walk through. So it's kind of going to be kind of interesting in terms of what's in those rivers. So I think over the last few thousand years we've been kind of battling clean water, bacteria, and we're kind of at a stage now where, as Dr. Kapoor would say, we're into the sort of genomics area and using AI as a means to go forward. Now, when I talk about AI for myself, this is like hair trigger. Okay, what on earth's going on here? Can you go back somehow? Oh, here we go. I think I've got to stay here. So, okay, I'll move this side. So, if you look at this diagram here, you can see the center part, which is genomics, and this is my bag, really. I've been born in whole genomes. I look at whole genomes, and that's part of what I deal with when I talk about AI. What I'm interested in is that main section there, exome, whole genome, ChIP-seq, but I'm also interested in transcriptomics and proteomic integration and how they work, how the proteins work, and how that's linked into the clinical information. More recently, I've been looking at single cell and spatial transcriptomics, which is kind of an interesting area for us to look into. Okay. And what we're seeing here is a use of sort of looking at biopsies from one side of things, or slides, pathological slides, and then we are bringing this into a Visium spatial transcriptomics, and then we're bringing in single-cell data into this. And what this gives us is a 2D picture of what's happening within the cell. I don't know what happened there, it just moved automatically. And what this allows us to do is then do slides of this, and we can actually build a real picture of what's happening within the cell itself. So we can get whole transcriptome, we can get interesting into cell morphology, and we can look into proteomics as well. And equally, when we're looking at missed the slide here. This is not working, I'm afraid.
Can someone advance it for you?
Yeah, I think this is not working.
You're holding it.
Oh, I see. It keeps going forward.
Okay, I'll operate it from here.
Okay, can you go back one? And one more. One more. Okay. I thought I missed this slide. So my background is in human genetics and agrogenetics, and so I've been a programmer since the age of 8. Yeah. My institution comes from Oxford University, where I did diabetes research, and I also did a computer science master's in AI, where I looked at clinical data. I also have a deep interest in blockchain and distributed ledgers, and I've been at the front line of sort of clinical genomics and real-world patient information for the past 20 years or so. I've sort of looked at sort of AI, Gen AI, and we're going to some examples of how this is actually working now. Oh, no, is this working? Oh, that's perfect, thank you. Right. And I'm at war with cancer and metabolic diseases. Cancer for a particular reason. We've heard some patient studies today. When it hits home and it hits personally to you, you get at war with these things. And so I'm happy to talk about that side of things, maybe on the panel itself. I think we've touched on the kind of areas I'm interested in. No, this is fine. So one of the interesting areas that I've been kind of looking at, and all the areas that we're kind of considering at this moment in time are based on computational code and AI. The way we are defining these clinical data atlases, and what I mean by a longevity clinical atlas is a repository, a gold standard of information that we can draw upon. And it really defines on you, the groups here, to define exactly what is important there. The data itself needs to be in a fair and fully curated manner, and then bioinformatics needs to be provided in a steady and interesting way. And the data sets need to be shared in a particular way. And in this one instance here, we can kind of look at the MOL blockchain as a potential area for accessing that data. Can we go back? Okay. Oh, no, next one. A part of what I'm going to talk about today is telomeric reversal algorithms. This is one particular one that we're looking at where we can actually go to the steady state of where a disease is and draw concepts going forwards and backwards. So it allows us to then infer concepts. And as I put here, it allows us to design future effects in the actual projects themselves. And we can do bulk RNA analysis on these particular sequences here. Does this have a pointer? No. Okay. The table you can see here is a list of genes that are associated in the telomeric regions of a chromosome. And I think you saw a diagram earlier where you could see the end of the chromosome. And as that degrades as age, you see errors there. We can see disease-related genes, before and after effects, and this can be, again, put into the types of AI algorithms that we can use. We can build in mathematical regression models, so we can actually find in sort of linear models for predicting various types of things. We can actually do survival models, and these also can be included in a whole host to include sensitivity, precision and accuracy within the actual model itself. And again, these are all elements that are used within the AI pipeline itself, which we'll go into. And of course, we're going to use multi-omic data, clinical information, so that we can actually design some disease biomarkers, drug responses, predictive modeling, and then pathway analysis on these particular clinics, but involving as much information as we can within the pipeline itself, within the AI pipeline, so that we can infer some really deep concepts. And of course, one interesting aspect of AI is to actually then dig into drug repurposing. We can actually go into things like clinicaltrials.gov and pull out relevant clinical trials. We've kind of seen this with the COVID vaccines, where rapid drug prototyping was done through vaccine development, primarily because they were pulling things that had actually gone through clinical trials itself. So the FDA approval was kind of sped there. I mean, we've got companies in the UK called, I think Helix is one of them, that are doing some really interesting elements in here. But what this is allowing us to do is to do some really interesting elements of drug repurposing within the actual pipeline itself, and we can pull that information into the system. Within the UK, we're blessed actually. We have the UK Biobank, we have the 100,000 genomes, which is a 500,000 genomes project now. And of course, we have the 100,000 newborns project, which again gives us a whole area for us to then go into and sort of dig into the details here. So we can actually find some really pertinent information. And of course, all this information in this is fully characterized, and the patient information is sort of here anonymized, so you can't access that if you're a corporate individual. But if you're doing this research within the UK, you can actually find some really interesting information. One of the interests that you probably saw at the beginning of the slide was kind of an interest into space and NASA. And one of the areas that I kind of think in terms of longevity for myself, and particularly when it comes to telomeric interest, is where we're going in terms of space. Previous one. And we can see ourselves from the Cassini point there, and it's a little dot along that line that you can probably see. And then last month we saw Elon Musk launch a rocket and then bring a rocket down that was captured. And I was in Calgary yesterday looking at that building, and that building there is exactly the same size as the building that was captured, to give you an idea of where we're going in this. No, previous one. And one thing I used to ask people when I did this at SpaceX was that everybody put their hand up, but does anyone want to go to Mars or visit Mars? Is that a yes or a no? What about going into space? Nobody? Oh, there we go. Okay. Well, it kind of comes back to. I always go back to Gilgamesh in his journey, because next slide, please. So what we found is that if you were born on Mars, your life expectancy will be very short, and there's a okay, 50 years seems pretty short to me. Maybe not to Gilgamesh. There's a very high chance of late-stage cancers. There's a high mortality rate. There's an issue with gravity, and there's many other effects in there. Elon Musk would call it, he calls it the SOB, he calls space an SOB. And somebody at NASA said telomeres are just destroyed in space, and that's primarily because of the well, we're protected on Mother Earth here, so we're kind of really impressed by that. But unfortunately, Mars is not at this moment in time. I think once we get green Mars, then there's some potential there to live on Mars. But the current reality is, next slide please, is that we need effectively continuous monitoring of our telomeres and a lot else as well. And I think this is more like how we're living on Mars, and so it's not particularly applicable. Within AI, and we've talked about this over the last couple of days, input, output, or GIGO is garbage in, garbage out, is one of those key elements here. Poor quality data going into a system means that the results you get going out are going to be equally garbage. High quality data is really important. And so, next slide, okay, should come as one. So what I talked about yesterday was FAIR, which means it's findable, accessible, interoperable, and reusable. And this is really important when it comes to getting data, whatever type of data it is. If it's whole genome data, whatever we're looking at, whatever we've been talking about today, it has to be in a way that it's accessible in a way. Dr. Kapoor has been talking about the way we protect that information, protect that data, and that's where things like blockchain come in, like NFTs come in. So it's a way of making sure that that data is in a secure way, and we know where it's coming from and who's done that. Next slide, please. I always find this kind of interesting slide. John McCarthy, who died a year or two back now, it's a sad loss really, but he first coined the term artificial intelligence in 1956. Not many people know who that guy is, and it's a sad part of the community that people don't know who he is. I think most people kind of really sort of understood where AI was when it came to things like Deep Blue beating Kasparov in 1997. Some of you are probably too young for that. Maybe you know about Watson and Siri. That was in 2010 and 2011, which seems a long time ago now to me. But one of the really interesting points of AI and where it kind of started to explode in terms of VC investment was the Harvard study, which was the first use of AI where it predicted BRCA1, BRCA2 testing for breast cancer and on a patient. And this is the first time that it was done without any kind of biopsy or surgical intervention there, which is kind of really impressive. And this one actually keeps shocking me now, but it shouldn't really because I use it so much. And ChatGPT. Anybody use ChatGPT here? Everybody. Okay. That was only 2 years ago. In fact, less than 2 years ago, which still blows my mind in terms of this, and in terms of the healthcare sector. McKinsey says it's between $60 and $110 billion a year. I think it's actually a heck of a lot more than that myself. Oops. Going back. And so 2 years on from the large language model the foundation model that's ChatGPT, there's this interesting thing that happened a week or two back. Can I have the next slide, please? That was predicted that the HiRA 1 LLM AI predicted that Trump would win by plus 300 votes. And this was a $10,000 home-built computer, which is kind of impressive. And it was only on AI data. There was no poll data associated with that. So the Internet of Things is a really powerful element of this. And we're kind of seeing how foundation models are starting. The ones in blue here are related to sort of related to health and healthcare. And various, so people may know AlphaFold and BERT and things like that. Next slide, please. Next slide. Nope, back. Too much. There you go. This will do. And we can see that some of those early models we can actually do on a basic 4090 computer. Your son and daughter may love you for having one of these as a gaming computer. But in your lab, you can actually run some quite simple models on those. If you're going up and you need to do more analysis, then we need to bring in more and more data. OpenAI, this is GP4, not GP40. GP40 has put that over $1 billion now. So it's a huge amount of money that's invested. And as we see here, you need a power station to actually run that. So you need a huge amount of compute resources and equally a huge amount of compute power. Actually, the Chinese have got a really interesting model, which I'll probably talk about on the panel. Next slide, please. I've tried to put my AI vision and my AI question, because it's all code, in English for you, so to give you an understanding of the way the AI works. So when we're looking at real-time patient AI, and we're looking at treatments, these are the kind of approaches that I do. I look at screening, am I at risk? What diseases, what do I have? Will I get sick? Will it get worse? Will the medicine I take work? Are there any side effects? We sort of talked about ADRs yesterday, but in the UK, 46% of hospital fatalities are based on ADRs. And is the medicine working for me? These are kind of really important elements to consider. Next slide, please. Oh, wait. Yeah, next slide, sorry. I'm going to bring in the concept of agents and moderators, and this has nothing to do with James Bond or anything. But it's a way of how AI is going to be working in the future and how we can actually do some serious prediction. And I'm going to give some examples in terms of telomeric reprogramming. But again, when we're looking at moderators, we're looking at how people with certain genotypes and phenotypes get sick. We're not looking at individuals, we're looking at how the genotypes and phenotypes get sick. And that brings in ancient DNA analysis too, because we're looking at ancient DNA and how, where did a mutation evolve. It's kind of really an interesting concept, that. Is the variant real? Is it, and who's it in? And what does a gene do in the particular body? Who and how common it is in the general population, and do we have any pharmacogenomic data? Do we need to do rare variant burden testing on these kinds of things too? And these are kind of important pharma questions, because in clinical trials, only less than 7% of clinical trials actually are successful. So we have a huge failure rate in the pharmaceutical industry, and so AI is a prominent area there. Next slide, please. As I said, Gen AI is all about code, and there are some little helps with friends here, and I won't go along all this particular slide itself, but as we're running through the pipeline itself to get some targeted summary. Next slide, please. Oh, no, back, no. Back. Okay. We can use an input, and so this thing here with the PanQ and everything that Viral are doing can actually feed into this system. When we're looking at clean data going into the system itself, this is where we need to get information going into the system. All the telomeric data we use is vectorized in an embedded model and stored as a vector DB. Next slide, please. No, back. And then on the bioinformatics side of things, we do some bioinformatics and data science and software as a service as a pipeline. Next slide, please. And then we can run various types of models. And we can actually train those models. So does anyone know about how to train a model when we talk about this? Has anyone seen how we train data at all? Okay, next slide, please. So that young fella there, goodness me. Shows you how long I've been doing AI, isn't it? So we start with input, so it could be a slide, it could be anything. And what we're doing is we're learning we're learning cycles, we're learning understanding, we're learning exactly what's happening based on input. We can then generate a tumor type epoch, and then we can then do a scan on an individual. We can take biopsies from the skin, we can take images from the skin, just like Dr. Paul talked about, and we can actually pull that information out and relate that to the AI itself. Next slide, please. What we can then do is do generative AI, and within the industry that use this, it's reducing time to gene analysis using this particular pipeline from 16 hours down to 1.5 per gene. And that's with people that know what they're doing. We estimate that when a lot of people are doing this, they're looking at months at a time. So we can take months of analysis down to a few hours, if not minutes or seconds. So when we're looking at cancer patients, when we're looking at all kinds of metabolic diseases, it's kind of really important here. Do you want to go back? The interesting part here is to build the LLMs, and at this particular point here, we're looking at those genes of interest that are related to telomeric epigenetic regions, and so we're kind of looking at how that information and what BIR can bring into this particular area, and we can generate reports. Next slide, please. And how the AI works at this moment in time and how we can get really good, interesting foundation models is that we are taking a research agent, and these are basically Python scripts or code, whatever type of code you want to be interested in. And so we have one interesting area, the research agent will then generate a particular question of interest. Next slide. It's then asked, it's sent to the QC agent, which then goes and verifies that, just like you would do with ChatGPT. And it checks that information for validity, factual correctness, and then sends the answer back. Next slide, please. And it generates the feedback. And then the reagent goes, that's interesting. What about this? So then it sends it back to the QC agent. And just hold. And this continues and continues and continues. And these are those learning cycles that we talk about. It's very simple. No human in the loop here. No human in the loop. Okay? It's allowing us to generate some really interesting concepts. But the problem is, we get these things called hallucinations, which are similar to what humans do. You can be talking about a particular gene of interest, and it suddenly starts talking about what we were talking about yesterday, hockey or something. To an Englishman, hockey's a field game, whereas you play it on ice or something. But what we then do is, next slide, we then bring in something that's called a moderator code. And so the moderator code then tells these guys, next slide, the moderator agent oversees the communication, so it's making sure, and it brings those two AI agents back onto point. So when the AIs are going off target, it's saying, no, come back to the actual question of interest. And when the actual interest has been met, the QC has been met, and the communication is then delivered to the user and it's identified to the users. And if there's any issues with the data in turn, and it's generated. And then we can generate a report based on that. Next slide. This is one instance of that particular area. It's a multi-AI Docker container, if you know anything about containerization. But each one of those LLMs is a containerized unit. And then we can build a portrait of an individual by grouping these containers together. And then this allows us to then do some real cutting-edge AI analysis. Next slide, please. What this allows us to do, so all that pipeline that we talked about, all the agents and the QC agents talking to each other and the moderation, is that middle section there, the LLM. What we can then do is we can bring in preclinical reports. We can bring in all kinds of information from the great team. We can run the Panomic application. And we can also add a GUI onto the top of this element here, where it allows us to create some really interesting questions. Do I have data from a particular gene of interest? And then it says yes, and it generates that particular information. Quite simple. Next slide. I think where we're going is that we could quite easily, we've talked about wearable devices, and it could quite easily generate my weekly longevity program based on my latest Panomics profile or whatever data. And this could be in real time, this could be automated. This doesn't have to be used putting in your ChatGPT prompt, as Dr. Kapoor's team are doing, and integrating this all into the system here. Next slide, please. And for the telomeric side of things, I'm actually looking at one particular genes of interest that will be interest to me. Next slide. Next slide. Over the next couple of years, I think we're kind of already looking at the sort of scientific literature, imaging, various types of biological data, and clinical reports. These are kind of where we're now. We're kind of bringing those into the systems themselves. Well, the interesting areas that we're going to go in and follow into is as I think we've talked about, and Dr. Kapoor's talked about, which is these digital devices and everything here going into the system, because what that will allow us to do is infer some really amazing concepts. Next slide, please. Into the deep future, just like we have ChatGPT that we can actually run all kinds of analysis on now, each one of you will effectively have your own foundation model. You'll have your own version of ChatGPT that's for you. And it's really hard to conceptualize that, because, as you saw earlier, it takes a compute center and a power station to run one of those. So it's multiple power stations here. But as Dr. Kapoor and ourselves have talked about, we've talked about quantum computing, QCOM, quite a lot. And so as the quantum computing advances, we'll see that real-time models and real-time pre-treatments come a part of this. And this is going to be a really interesting aspect of us living much longer lives. There's a QR code up there if you want to get my information, and thank you very much.